As the Obama administration struggles to roll out the Patient Protection and Affordable Care Act, more widely known as Obamacare, more Americans are waking up to what many of us have repeatedly warned against, that this bill will not work. Obamacare is riddled with federal mandates, is incredibly costly. It will not deliver on what it promised, true reform of our nation's healthcare system. In fact, recent polls state that 54% of Americans disapprove of Obamacare, and only 19% believe their families would be better off under this act. The president sold the Affordable Care Act claiming it would provide insurance to 30 million Americans, improve the quality of care, and save money. Instead, this law put our nation's healthcare system on thin ice and jeopardizes the health of those who currently have coverage. Seniors' Medicare coverage was already cut by the Democrats by $716 billion to fund this grand experiment, and the middle class will soon see their healthcare costs skyrocket. We've learned that, like many of President Obama's policies, this simply doesn't add up. It is time for the Obama administration to come clean. At the beginning of this month, his own administration announced a one-year delay in the Act's employer healthcare mandate, further affirming what key architects of the bill have said, that the bill is a train wreck. The full truth, and what even his own advisors believe, is that this bill is too complex to implement, and it won't bring down healthcare costs, nor improve coverage for all. Just this week, my office received an email from Stuart in Sycamore, a businessman who is concerned with Obamacare as it rolls out. Talking with his friends in the business community, Stuart has found that the vast majority of them agree with him that the law is simply a bad law. Joanne from Johnsburg works for minimum wage, but her employer switched carriers after their premiums were jumping up almost 50%. She now has less care and can't keep her current doctor under a new plan. She told my office that she doesn't want the government telling her what to do or which doctors to have. As the government selectively enforces this law, I will do everything in my power to defund Obamacare and replace it with a smarter approach to healthcare reform. Real reform should focus on you, the patient, and preserve your right to see the doctor of your choice. It should protect small businesses and lower costs. It should give seniors the peace of mind they deserve. Defunding is just the first step in the process to repeal and really fix our nation's costly healthcare system. That's why I've joined with over 65 of my colleagues on a letter urging House leadership to affirmatively defund the implementation and enforcement of Obamacare in any relevant appropriations bill brought to the House floor. In addition, this July I voted in favor of both H.R. 2667 and H.R. 2668 that delay both the individual and employer mandates. By delaying the employer mandate while leaving the individual mandate in place, the president put big business ahead of the American people. This is about fairness. Hardworking taxpayers should be given the same treatment as businesses. Democrats are now realizing that this is not the bill they agreed to, and many have signed on to delay both mandates as they hear from their constituents who are outraged by Obamacare. There isn't a single poll that shows a majority of the American people in favor of Obamacare. In fact, just the opposite. We need to ensure that the voices of the people of Illinois and this country are heard. We must stand together and do everything in our power to repeal this unjust, unworkable, and unfair approach to healthcare coverage.